Welcome back to Montana this morning. The time now is 6:28. Joining us today, we have Dr. Malcolm Horn from the Rimrock Foundation. And like I mentioned, May is a mental health month. And so this is actually a topic that I'm very much into and passionate about when it comes to reaching out and seeking help. So Dr. Horn, tell us, what do we have in our community going on right now to look out for these folks?
Yeah, so there is a lot happening in our community in terms of mental health struggles. Like, just turn on the news, you can see that there's lots of stuff happening. But the good news is there's also lots of hope. Billings is very fortunate to have a ton of great counselors. And Rimrock, we have a whole span of counselors. We have substance use and mental health counselors. And I think it's important for people to know that those two things often go together. So if you're struggling with both, right, because most people, oh, it's a stressful, anxious day, I'm going to have a beer. The next thing they know, they're having more and more beer. Now they have not only kind of a stress and anxiety problem, they also have a substance use problem. So it's really important that people know that there is help, but they got to know what kind of help they need.
And are there more people seeking help right now as we work our way through hopefully the tail end of this pandemic?
Yes, I absolutely. And I for 2020, my caseload, my personal caseload, so many more of my patients were expressing struggling with, if they had a substance use issue, struggling with being triggered, craving, feeling overwhelmed. And then just my patients that had, your general anxiety and depression, they noticed an uptick in their own symptoms. And so I think even as we come out of this pandemic, I think there's still a lot of questioning, is this going to happen again? Can the economy ever really fully recover? What's going to happen next? I think there's still a lot of that just hanging out there for people. And I think people need to understand too, that even if we say, okay, there's a vaccine and the pandemic goes away, things in mental health worlds don't just, well, they're done. No, you sometimes have to still go through that process of recovering. Anxiety, depression, PTSD, it doesn't just go away. There's often this ripple effect, this aftermath, and people sometimes then have a lot of shame and stigma about getting help because they feel like they should be over it. It should be done. That happened several months ago, or that happened several years ago. I should be over it. It should be fine. And I think that just feeds that stigma that I'm not fine. I'm not okay.
And I want to say too, just from personal experience, if someone's watching right now and they don't feel quite right, they're not quite satisfied with their life because of these thoughts or feelings, they deserve to feel their best.
Absolutely.
Everyone deserves to feel their absolute best.
Absolutely.
And so all it takes is that call out and reaching out. And speaking of reaching out, what is the best way to get a hold of the folks over at the Rimrock Foundation?
Absolutely. Calling our main number, 406-248-3175. That is the best way to get a hold of us. And we have a whole team of admissions, of peer support people, of outpatient counselors. We have a ton of people that are there. We come to work because we want to help. And so people need to know there is help. There are resources. And you just have to be able to say, all right, I'm willing to ask for it. And let's see if people can help you meet your needs.
And those counselors, I mean, they do amazing work. They'll help you. You think you know yourself so well, but they'll help you dig deep down within, and you learn so much more about yourself, and then you get down to the root of those issues, and then it's just all solving problems from there, and that's how you start getting better. So yeah.
Right, absolutely. It's a way to feel empowered, and I think that's the thing people need to know, is there is hope to feel empowered for yourself.
Yes. Dr. Horn, thank you so much for your time this morning and the
You're
work
welcome.
you are doing for our community. We appreciate it so much. Thank you very much.
Thank you for having me.
Thank you. We'll be right back after this break.